Okay, time for the elbow joint.
I'm going to show you how to scan the posterior elbow joint. So we normally have our patients supine with the arm across the body like this. For purposes of training, what we're going to do is we're going to get our skeleton model into what is an unnatural internal rotation, just so the camera can pick up the angles well. So the orientation of the probe is going to be long on the humerus. The landmark is going to be the bony tip of the olecranon and the humerus here. Now, the movements are going to be some slight micro movements towards the ulnar side and the radial side of the arm, and then some slight angulations. So you make sure you have a bright ulna and a bright humerus. The area of interest is going to be in the olecranon fossa. There's a fat pad that communicates with the elbow joint. So that's what we see on ultrasound, and that's how you scan the posterior elbow joint.
Okay, now to draw it. So what do we see? Well, we know bone is this bright white stuff here. So there is our bone. Now that's the humerus, because this is the humerus, okay? And here is the ulna. Now specifically it's the olecranon process of the ulna. Cartilage. Well, we can see some black cartilage here. Now I've kind of drawn over it, and we know that there's going to be some cartilage here even though if we can't draw it. Fluid. Well, we know there's going to be fluid here, and it actually continues out in a cleft along this way, and you can't actually see it. Now, the interesting thing with this is actually if you put your needle here with cortisone, the fluid will actually flow up and around into the joint. It'll do that with cortisone, but it probably won't do that with hyaluronic acid because it'll get hung up in the fat. Ligament. Well, what connects bone to bone is ligament, so we know there's going to be ligament here, okay? Tendon. Well, we do see some of the triceps tendon coming right here. And muscle. Well, all this black stuff up top here is muscle. There we go. So we're going to clear that away, draw it one more time. Bone. This is the olecranon process of the ulna. Articular cartilage of the humerus. Cartilage. Fluid, we know there's going to be fluid here, and it actually comes all the way out there, but you can't see it, and we know that if there is some joint fluid down here as well. Ligament, well, what connects bone to bone is ligament, okay? And tendon of the triceps right here. And muscle, well, this is all triceps muscle. Excellent. We're going to clear that away and move on to the live model.
Going to show you how to inject the elbow joint without going through the radial head humeral interval, which spares that cartilage. You can go into it from the posterior approach into the olecranon fossa. Your patient position is supine with the affected elbow flexed 90 degrees, and I'm going to be treating the near elbow. My landmark is going to be the olecranon. I'll get that on the right-hand side of the screen now. And my orientation is going to be long on the triceps tendon, which we can see annotated by the yellow arrow here. To do the injection, I'm going to come out of plane and I'm going to touch the needle into the very base of the olecranon fossa. The angle of entry is going to be just like this. There's a slight modification if I'm injecting a more expensive or more delicate product like hyaluronic acid or PRP. When I'm doing that, I really want to make sure I get my needle tip touching articular cartilage to be sure I'm getting into the joint space, in which case I slide a little distal, flex the elbow just a touch more so I can see the articular cartilage of the humerus in view, right where the tip of the yellow arrow is now. And I like to come in plane along this angle and touch my needle tip to where the yellow arrow is pointing. And that's how I do an elbow joint injection.
Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.